Hey, so if you're here for the webinar on what you need to know about your eggs right now, you're actually in the right place. I'm Bree from Vital Health, and today we're joined by Dr. Alicia McCubbins. Dr. McCubbins, can you go ahead and introduce yourself?
Hi, yeah, thanks, Bree. I am Dr. Alicia McCubbins, a naturopathic physician trained in functional medicine. I also have a passion for working with couples who are hoping to have their families grow. In combination with my functional fertility expertise, I have my own experience in trying to conceive. My husband and I tried for about 3 years and tried a number of different modalities, but we were successful in using a functional fertility approach. I ironically had been seeing lots of patients in my office, in my primary care office, who were trying to conceive. And so it turned out that about 90% of these individuals kept getting pregnant in less than a year. And these were individuals that were told that they're either infertile or had a condition that was maybe a big obstacle to getting pregnant. Most of these individuals are in their 20s, 30s, and 40s, and they're trying to get pregnant with the guidance of ideas that are going to help them conceive in the least invasive or the most natural way possible. But I also see people who are maybe seeking out IUI and IVF. Functional fertility is a really great match for them too. But then I also encourage individuals who are just thinking about getting pregnant someday, maybe 5-10 years down the road. It's good to start thinking about implementing naturopathic care, foundational ideas for optimizing your health so that it's easier in the future. Right. So most individuals that come to me have this diagnosis of unexplained infertility. And maybe that's because they've been working with lots of providers who haven't really given them answers, but they know that they're fertile really. And so what I find is that these individuals really benefit from supporting the egg, the seed of their reproductive system. So whether it's the egg or the sperm, these are our seeds. You can think of the body as like a plant, right? And so each plant needs a really nutrient-dense, perfectly optimized pH, watered soil. And so if we think about our bodies that way, we want to give as much energy and nutrients to our eggs as possible because that is what really produces pregnancy. So once a month or so, you're having a menstrual cycle, you're ovulating, and we're releasing that egg. And we just expect this to happen naturally, and it should. But there's many factors in our society, in our world today, that can impede that natural process. And so whether it's having a history of being on birth control and having this like post-birth control syndrome, or even just being in a state of chronic stress, whether it's like something you identify with or not, we all live stressful lives, and that can impede your ability to ovulate or even have a optimal egg health. So I like to pause and think about, what does the egg actually need? How much oxygen is it getting? And what nutrients do they need? And how do we actually address stress? So we only have, a set number of eggs at birth. And so this kind of creates some urgency in us, especially when we get in our 30s and 40s, we're starting to think, oh my gosh, am I running out of eggs? Well, the purpose of this discussion is not to cause fear. It's to think about, how do we optimize each egg that you have left? But then also, thinking about it ahead of time. You need 3 or 4 months before conceiving to truly support that maturation of the egg and sperm. So these tips that we have for today are really going to be appropriate for everyone, whether you're thinking about conceiving, whether you've been trying to get pregnant, or even if you're thinking about freezing your eggs down the road. If we optimize egg health now, we're looking at a brighter future. And so you may have PCOS, you may have endometriosis, you may have all of these diagnoses that actually make you think, I may not get pregnant. And I want to stop that whole train of thought, because I often see those diagnoses when I see some clients, and those are things that we can easily overcome by just balancing all of the organ systems. But for today, we're going to talk about how to support your eggs through 3 different areas. 1 being nutrition, 2 being supplements, and 3 being lifestyle. So nutrition. I like to focus first on the functional aspect of nutrition, before we even get into the specifics. First, take your time with eating. Look at your food, smell your food, taste your food, because that's all going to affect how you actually digest and assimilate those nutrients. You know, you could eat all the best foods, but if you're eating on the go or stressed out, you're not getting the most bang for your buck. Try not to skip meals, because that also will influence your blood sugars. So I really do encourage people to eat 3 meals a day, even if they're trying to lose weight. It's important to try to maintain a healthy blood sugar level throughout the day. So number one, as you can see on the slide, we want clean foods. And this is a really big topic, and you can read our blogs more about this for more information. But the goal is to eat as much organic as possible, and specifically avoiding what's called the dirty dozen and eating more of the clean 15. The EWG comes out with, Environmental Working Group, comes out with the year's top foods that are either highest or lowest in pesticide residues. So that's important to consider in terms of egg health, is like what else is going in your body. Whole foods means, you know, preferably things that are not packaged or prepared already. Going shopping around the perimeter of the grocery store is getting your cleanest and most intact whole foods. And then, you know, going for mostly plants, because that's where the nutrient density is. Some people ask me, well, geez, if I eat just vegetables all the time, I can't keep them clean or keep them alive in my fridge long enough, or I'm at the store every day. This is an opportunity to actually shop in the frozen section, because frozen veggies and fruits are picked fresh and then frozen right away, so that it maintains as much nutrient density as if you had just picked it. It's pretty impressive. I mean, it's better than even getting some foods at the co-op where they've been picked 2 weeks prior. So that's it for clean foods. There's more on those blogs though. Number 2, really, again, going back to balancing blood sugars. And this is a hot topic because it really ties in stress too. What we can do to manipulate healthy blood sugars throughout the day is to focus on meals and snacks that are heavy in protein versus carbohydrate. Protein and fat are better for maintaining a level blood sugar, whereas carbohydrates can kind of cause this up and down. And carbs being like your rice and breads and crackers, things like that. Those are all fine. And I'm not saying be carb free, but pair it with protein. So like an apple and peanut butter, or celery and almond butter, you know, it's having the two to maintain good blood sugars. And then
protein, I just wanted to ask, like, what is example of a snack maybe, or would it be like nuts? Would it be like hard-boiled eggs or something?
Yeah, so I mentioned nut butters because that's just my favorite, but nuts, seeds, that's also a good fat. Sure, leftover meats, like I'll often cut up the chicken the night before and then cut up little pieces so that I can snack on that the next day. And then other proteins would be like even protein powder for people who are really not into just eating. Like you can mix it in water. That's a nice, easy way to get protein in. But yeah, protein comes in a lot of ways, even in vegetables. So like broccoli has one of the highest levels of protein in it.
Awesome, it's good to know.
Mm-hmm.
And then we were talking about good fats for building hormones.
Yeah, so good fats, you know, that comes in the form of things like avocados and coconut and seeds again. And then I also think about oils, like, you know, we want to use the right kinds of oils with cooking. So oils at a high temperature would be more leaning towards like the solid fats, like coconut or butter, or even like lard or tallow. But then, you know, olive oil and things like that are great for drizzling, where you're not necessarily cooking at a high temperature. Getting a lot of fat in your diet is important because fat is the building block for making your own hormones. And I will admit that most of my women that come in are not making enough hormones. It's not just in menopause that you're like slowing down the hormone production. It can happen much sooner. And that could be due to stress too, or many of other reasons, but good fats help with that. And then the next tip with colorful fruits and vegetables, that goes into like the clean foods. So, you know, we want nutrient dense foods, but the more color that you get and the more diversity you get, the more nutrient profile you're getting. So I encourage people to eat the rainbow. And that's a beautiful way to think about it. when I prepare my plate, it's not as beautiful, but when I prepare my kid's plate, it's like I literally will make the rainbow on his plate. And that feels so good knowing he's getting vitamin A, B, C, D, E, and like all these antioxidants that are great for his immune system. So do that for yourself as well. And then the fifth thing, fermented foods for the microbiome. That's your immune system's bacterial balance. And this is not just for your gut, this is extending to every tissue in the body. We have good bacteria on the skin, in the nose, in the abdomen. I mean, everywhere you have tissue, you have bacteria, good and bad, but the point is to keep a really good balance. Eating fermented foods like sauerkraut, homemade pickles, kombucha, kefir, high quality yogurt that's not high in sugar, so basically whole fat yogurts, those are nice for encouraging an optimal bacterial balance.
Awesome. Yeah. And there are a couple people that sometimes ask, are there specific diets we could follow? Like, some people might think the keto diet might work, or just because it's a little bit more structured and maybe they're not so good at following these 5 tips. What's one diet that you'd maybe recommend to look up?
Yeah, it's nice to have something with structure, something that you can Google or Pinterest, So I like the Mediterranean diet for fertility support because, and for most people, honestly, because it's encouraging the fat, the vegetables, fruit, whole grains, and protein and fiber. So like beans, nuts, and seeds. It does allow for animal protein, of course, but that's not the emphasis. Like whereas you might think of Atkins or paleo as being like all meat. That's not the perspective of that. It's like, yes, good quality protein, but also leaning more towards like clean fish. So wild caught fish, local is even better, but the idea of that is to get the better fats, the omegas that are within the fish. And then when you do go towards meat, thinking more about the leaner meats like chicken and turkey, even though I'm a huge fan of like lamb with all that extra fat, because again, that helps with hormone production, but that's more of someone's preference. So the other question is, what about alcohol? And I like my red wine, but I also like it because it's rich in some antioxidants and nutrients like resveratrol that can be really helpful also to egg health. But the more important thing to talk about is moderation with that. So 1 to 2 glasses was originally the recommendation per day. We're kind of stepping back from that and recommending maybe just a couple times a week, 1 or 2 glasses, but we have to use our intuition with that too.
So I want to move into supplementation, which can be a hard area to navigate because there's so many options out there, even when it comes to prenatals. But I think today we can touch upon some tips from you on how to pick the best ones and what to really look out for.
Yeah, I agree. I get a little nervous about people just buying supplements at their local pharmacy or even big box stores because they're more affordable that way. And I am all about financial wellness. However, there's certain types of supplements that you really do need to pay more for a higher quality. Prenatals, that's kind of middle of the road. So we all know about getting prenatals even before you get pregnant to make sure that you're not deficient in anything before you get pregnant. Especially when it comes to things like folate, B12, and iron. Those, if they're in a deficiency, can lead to an anemia. And anemia, you're already at risk for with pregnancy because you're building so much blood. So we want to ensure that you're at optimal levels before that. So a good prenatal will have methylfolate, not folic acid, and methylcobalamin as a B12 and not cyanocobalamin. The ones that I say not are synthetic and the body doesn't necessarily process those very well in some people. It's a genetic predisposition, but if you're getting a prenatal, just get a high quality one. A lot of conventional fertility specialists are even steering people away from prenatals that have vitamin A in it, which is ridiculous because it's not put into those formulas at toxic levels. They are at daily RDAs, what we need for vitamin A levels, and you're not at risk of toxicity just by eating more foods with vitamin A. In fact, I think it's really helpful for our immune systems to have ample vitamin A, E, D, and K. Those are the fat-soluble vitamins. So then moving into the next recommendation for supplementation, fish oil is basically a must for most of my clients that work with me. The only caveat is for those who are allergic. I recommend doing a different type of oil, and we can be more specific to that one-on-one. And then also, you know, if someone is like not tolerating fish, you know, it's like you may not be allergic, but you're like, oh, I can't, it doesn't sit. A tip for that is to maybe try freezing your gel caps and then taking them with dinner so that they can pass before they burp up or you taste it. But honestly, a high quality fish oil really shouldn't have any side effects. The purpose of fish oil is it works as an anti-inflammatory for all the cells. So it's not just for your seeds, you know, your ovaries. It's for your skin, your heart, your immune system, your brain. I mean, those are all critical, especially before pregnancy. But also the quantity, the therapeutic dose is important for fish oil. You'll find that if you get it at a box store, you'll see that it's like maybe touting that it has 1,000 milligrams of omegas. But I don't really care about omegas per se. I care about the EPA and DHA omega-3s, and those are listed on a good quality fish oil, first of all. But then also you'll add them up and you want them to equal 2,000 milligrams a day. That's actually a pretty high dose even for high quality, but that way we ensure that you're getting a good dose. And then third, this is a big topic that I'll probably speak to a lot throughout the rest of this talk, is antioxidants. And so I have ways of supplementing antioxidants with a prenatal so that you're not taking different, like lots of different things. Sometimes the prenatal will include a lot of these, which is really convenient, but it's important to mention why they're convenient or important. So CoQ10, NAC, vitamin C, glutathione, even melatonin act as antioxidants. Antioxidants are basically like house cleaners of our cells. So our body makes free radicals as like, they're like waste products in response to stress from what we eat or from our environment. It's also called oxidative stress, hence antioxidants, cleaning out all that oxidative stress. That's important for the ovaries because this is such a tiny little cell and the seeds are such tiny little cells, and we want to ensure that it's getting optimal oxygen and not sludgy from these reactive oxidative stress species. So antioxidants are considered like neutralizers, but the thing that they're really cleaning up after is stuff like smoke, like if you are a smoker for sure, but also just, you know, passive smoke, whether it's from someone smoking on the sidewalk or fires in California. Other things that can cause reactive oxygen species would be like processed foods or pesticides, hence needing to eat organic, recreational drug use, or even barbecue grilling can cause, like burnt foods or cooking at high temperatures can cause more of that oxidative stress.
Yeah, and when it comes to oxidative stress, it's interesting because like everybody kind of experiences it in their own way.
Mm-hmm.
You know, whether you live, you know, where I live in Arizona, where sometimes the air quality is not so great, or you live in New York City and air quality is definitely not really good.
Yeah.
Maybe you have a clean diet, maybe you don't smoke. You're still putting your body through these external circumstances that normally, you know, in the nature, like way back when, like we didn't have.
Right.
As much as our minds might adapt to the new way of living, like our bodies sometimes can't keep up, which is why we need antioxidants to help clean things up.
Totally. So I have a really good story, well, not necessarily specific story, but an example of why these kinds of supplements are important. A lot of patients or clients come to me with this diagnosis that is not really a diagnosis. It's called unexplained infertility. First of all, I hate the word infertility because they're probably not infertile. But then second, it's unexplained. So they don't know why. Well, more often than not, it's, you know, one of these three factors that we're talking about, either, you know, not getting enough nutrients or needing to clean up, like with antioxidant support, or needing just some more lifestyle support for things like stress. But the it's almost kind of radical to see someone come in and simply be put on a really high quality prenatal, a fish oil or some antioxidant therapy. And then within 3 to 4 months, they're pregnant. And it happens over and over and over again. And it's so simple. And I'm like, why is this so easy? It's because we have to think about the functional fertility. How does the body get support? And it's really getting oxygen, nutrients, and circulation to the area. And that's really not that hard.
Yeah, and some of the patients that come to you and some of your clients, like, have they tried multiple specialists? What have they tried before where they didn't get results, and then just making that switch, they got the result they want. They were able to get pregnant and have a baby. What did they experience before?
Yeah, it happens all the time where they'll be put through lots of testing and everything looks normal, even imaging, or even they'll go down the route of IUI, intrauterine insemination, or IVF. And those things are wonderful, especially if, people have been trying a long time. It does have a fairly good success rate, not very high, but good enough, and for some people. But I like adding these things in to maximize their experience, whether they're going down those roads or not. Because again, it's all about the quality of that seed, that egg.
Yeah, and even if they're doing IUI or IVF, they can do all these things and see you and for a consultation to kind of maximize that benefit, because it's a lot of money to go through all that stuff, and
Yeah.
you might as well make sure it works.
Absolutely.
Yeah. And the next thing we want to talk about today was lifestyle. So lifestyle is a huge part of what helps our fertility, but it's also a really touchy subject because it's hard to make a lot of these changes. But even maybe a couple of these changes can make a huge difference. So let's go into that.
Totally. I feel like fertility clients are the most motivated people I've ever worked with. And that's why I love this, because naturopathic medicine is for people who are willing to do things. It's not just about taking things. It's not just about what you eat, even though that's a large part of it. There has to be this motivation for change and wanting to achieve your health goals. And so what bigger goal than having a child? But yeah, I don't really like talking about weight, because I don't think that we need to talk about numbers, and I don't think we need to talk about even BMI, so like body mass index. The goal is to find a healthy weight for you. And so, yeah, that's easier said than done. A lot of physicians or healthcare providers will say, go lose weight and come back. And it drives me crazy because there's no tools in that. So what I recommend is working with someone like myself, where we can find an individualized nutrition plan. Finding foods that are good for you, but also avoiding the foods that maybe are causing inflammation, like food sensitivities. That can affect your weight, but so can hormones, whether it's, your reproductive hormones, like we're so focused on with egg health, your menstrual cycle, things like that, or thyroid, which is very important to test before wanting to get pregnant, because often the conventional doctors will still test thyroid, but they may not do it in a comprehensive way. And it's really important for me to be confident that the thyroid is functioning really well if someone is trying to achieve a healthy weight, but also if they're trying to get pregnant. So, number 2, exercise. And yes, that plays into weight, but I like it more for the objective of encouraging optimal circulation. So, when you sit still for a really long time, your hands get cold, like mine are cold right now. You get up, you get moving, and you notice that your periphery warms up, and then maybe you feel like more cognizant, you have better mental clarity, you have better energy. That is a sign of getting oxygen to all your tissues. And so specifically for this case, we want as much oxygen to our eggs as possible so that they're as healthy as they can be before they're released and fertilized. So exercise is very important, but don't worry about being like, oh, now I need to start training for a marathon. I like the idea of just moving your body frequently throughout the day. Get up and take a walk. Even if it's 10 minutes, like if you're not in a routine of doing it, walk around the block, or, do some jumping jacks, do some push-ups, but it's the discipline of doing it frequently and just checking it off the list.
Right. And I think so many of us are used to, you go to work, so you're either working out before work or after work, and then that's all you do in terms of
Hmm.
physical activity, when really when we're talking about circulation, you kind of want to be moving around more often,
Yeah.
getting up, going to the kitchen at your office, taking a walk, just simple things like that, just to get your blood moving, get the fluids in your body moving, because otherwise you feel stuffed up. And then, you don't have all those things don't really have a place to go.
Well, and think about your
Yeah.
pelvis, especially if you're sitting all day, like at least you're up, you can move your upper body and everything, but we really got to move that pelvis. So I often tell women, even when they're pregnant, do some hula hooping because, you're getting that circulation going, but it's specifically for your pelvis. Squats are a good one for training for, actually having a baby, but also getting oxygen to the pelvis.
Yeah, and I know a lot of offices sometimes offer you to sit on a yoga ball. Take
Hmm.
the option once in a while, just change things up, because, not only is it physically stimulating, but it'll also probably be mentally stimulating too while you're at work.
Yeah. So another tip for lifestyle is to avoid those reactive oxidative species. So the oxidative stress we were talking about, where antioxidants clean up that mess. Let's avoid the cause of that mess in the first place. So the biggest ones, and I think these are all really obvious, but it's important to hone in on moderation as well as why are we avoiding some things. So alcohol, again, there's it's fine in moderation, but in those binge drinking situations are an issue where not only does it cause this oxidative stress, it can have an influence on your cortisol, your stress hormones, your blood sugars, obviously your liver, where your hormones are made. So, taking a step forward, it's like finding a healthy balance with alcohol. And then to just don't, I mean, that is obvious, we know better. If you are a smoker, take steps to at least decrease why smoking is bad. We all know it, but that biggest source. Third, cut back on the caffeine. I mean, 1 or 2 cups of coffee a day may still be too much for you. It just depends on the individual. Even tea can be drank in excess. I know a lot of people who hate water and they only want to drink tea. Herbal tea is fine. Just keeping in mind that caffeine does trigger cortisol, your stress hormone. And again, that can influence your blood sugars as well as your hormone production. I know that when I was drinking too much coffee, my digestion got super messed up, and that's not really optimal for nutrient balance either. So then coming back to pesticides, watching what you're eating in terms of the sourcing of your vegetables and fruit, but also your meat. Meat is what it eats, as are we. So what I really want to encourage is people to eat organic and whole fat dairy, because that's going to have an optimal level of omega-3s versus omega-6s. When something is eating more corn, like whether it's grass-fed beef versus corn-fed beef, the grass-fed beef is going to have a better omega-3 balance, and that's good for inflammation. Like that helps cut inflammation. Whereas that omega-6 heavy diet is causing more inflammatory meat. So, thinking about that in terms of your sourcing for like chicken, eggs, beef, lamb, eggs. I mean, all those the animal products too.
Let's go talk again about smoking, because you cut out a little bit. So
Oh, okay.
the point about avoiding smoking.
Yeah, so the smoking, I mean, we all know that we need to not smoke. And I think that, even when someone starts smoking, they know this is not optimal. But the goal for someone who may smoke already is to just try to decrease, at least do your best to back it off. Set some goals for yourself to back it off, because every cigarette, every puff has an influence on oxidative stress in your body.
Right. And eventually, if you are able to get pregnant, like that's going to be something you have to kind
It'll
of
be
challenge
really
yourself to do
hard.
anyways.
Yep, yep.
Is there anything like, do you have an opinion about vaping? That's could be a little different, but kind of also the same.
Yeah, I'm definitely in the camp of like avoid it 100%. It's just like smoking, because it's still causing free radicals in the body. And then of course, what else is in there? Well, there's polyethylene glycol and like other things that your body does not need. But I have seen some benefit for vaping for people who literally were trying to quit smoking cigarettes. And if they set goals for themselves, it can be a helpful weaning process. But, I'm not encouraging vaping, no.
Right. And like there's also a note that everybody probably knows somebody who drinks, smokes, drinks a lot of coffee, doesn't eat well, but got pregnant.
Sure.
Everybody's journey is way different, but these tips today we're going over just really to boost your own fertility and to boost health of your eggs specifically. So, we all have those stories of someone just getting pregnant and, that's all that they do. They're really talented at that. Yeah, but these tips are definitely meant to help you figure out and navigate the best way working with your lifestyle. But, there are ways to improve it as well.
Definitely. So the biggest topic of conversation, and I think this extends to every single client I've ever worked with, including myself, which I'll get into, but stress. Stress is another thing where we all identify with it. We all know how, negative impact that can have on our health, but it impacts all chronic disease, not just the desire to conceive or fertility issues. What I see the most is, whether it's good stress or bad stress, it still affects the body. So the thing that we want to do is evaluate what is it actually doing. Number one is we look at cortisol. That's the fight or flight hormone. It's accompanied by adrenaline and epinephrine and norepinephrine. But cortisol I focus on because the adrenal glands make it. And that's what governs your circadian rhythm. So it peaks when you wake up in the morning and then it bottoms out when you go to sleep. It should. Stressors throughout the day, whether it's, someone honking their horn at you, an argument, or even too much caffeine can trigger cortisol. Low blood sugars can trigger cortisol. Now, when cortisol is up longer than it should be or too often, or if it gets super wacky, that will impact your ovaries. And you may not release the right amount of progesterone, and then eventually not enough estrogen, testosterone. DHEA is another hormone that we need to focus on. And so it really is a pain because stress can totally throw everything off. And I think a lot of us women can identify with that, whether it's, a history of like aggressive exercise. I remember when I was playing sports, my periods were all over the place. Or if you just have like a trauma or a terrible grieving process and you're like, I'm not getting my period this month. Like that is way more common than people think. So I look at cortisol levels with a saliva test. And that's actually how I look at hormones too, like estrogen, progesterone, testosterone, DHEA. You spit it in a little tube when you wake up in the morning, and then again at noon and 4 and 8 p.m.-ish. And that gives us like that curve. And so we can support someone in on an individualized matter as to like, okay, where do these factors come in? Like, is your morning all messed up? Is it your afternoon? Like, it's really nice to look at something objective when we're talking about stress. So yeah, what I'm getting at is when we talk about hormones or when we talk about stress, we have the golden triangle, which is the thyroid, ovaries, which are on top of the kidneys, and the adrenals that are on top of the kidneys, and the ovaries. And so they all work in harmony. And if one of them is off, like the adrenals with stress, that's going to pull the other things with it.
Yeah, awesome. And that's something that a lot of people who might be seeking fertility advice, like, we don't know what you need individually unless we do some testing.
Right.
So, everybody can give each other advice all the time. Like I see it on Facebook all the time,
Oh, yeah.
Or like moms chatting with each other, but everybody's so different that, you're not going to know exactly, how stress is impacting your body or anything like that, really, unless you do a little bit of objective testing to
Right.
go along with it. But then also having like an expert consult you on what to do and being able to take their time and look at those results with you.
Yeah, perspective is everything. And that's why I feel like I finally had success, is like I stopped trying to control it all on my own and do all my own research and figure it all out for my own desire to conceive. It was when I like stepped back and got more stress support. So saw a counselor, got acupuncture, and I think that those two things really like solidified how we got pregnant. But I think that to round it out, I also had very low progesterone for a long time because I was making too much cortisol stress. And so it was multifactorial. It is never just one thing. And that's why it can be really hard for people to navigate it on their own. So reaching out for help is pretty critical.
So what's the next step for someone who might be listening to this webinar?
Well, I really encourage anyone that's listening now to explore our website a little bit more, vitalhealth.com, because there's going to be more information, like the blogs and maybe more webinars and videos down the road. But that will give you some more information to start implementing some of these ideas right away. And then I encourage you to just set up an appointment. We can really dig into your personal health, you as an individual, and find out what you need to build more functional fertility support. So whether it's nutrition, supplements, or lifestyle, we can round out this treatment plan that's just for you, with an emphasis on egg health, but also, you know, maybe troubleshooting some things that you've had going on aside from that.
So if you want to book an appointment, you just go ahead and enter this bit.ly link, and it'll take you right to Dr. McCubbins' scheduling page. And you know, if you're still on the fence about if functional fertility can help you, you can email our support team at hello@vitalhealth.com. And we're really, really happy to answer any questions that you have. So thanks for joining us for this webinar. And we can't wait to send you more content like this from Dr. McCubbins and more from our Vital Health team. So thanks.
Thank you.